When you have Parkinson's disease, you may experience episodes where your symptoms worsen, known as OFF episodes. Inbrija capsule, with inhalation device is used to treat these episodes in people who are already taking carbidopa/levodopa medicines. It helps to prevent symptoms like shakiness, stiffness, and difficulty moving from returning. It's important to note that this medication does not replace your regular carbidopa/levodopa medicine, so you should continue taking it as directed by your doctor. Parkinson's disease is caused by a lack of dopamine in the brain, and levodopa helps to change into dopamine to control movement. This medication provides extra levodopa when needed to manage the return of Parkinson's symptoms. The recommended daily dosage and the best time to take Inbrija capsule, with inhalation device will be determined by your doctor based on your individual needs. Be sure to follow their instructions carefully for the best results. Before using Inbrija capsule with inhalation device, it's important to read the patient information leaflet and instructions for use provided by your pharmacist. Make sure to learn how to use the inhaler properly and ask your doctor or pharmacist if you have any questions. Remember not to swallow the capsules. Instead, use the special inhaler to inhale the powder in the capsules. Inhale this medication by mouth as directed by your doctor, when symptoms of an OFF period start. Each dose is 2 of the 42 mg capsules. Make sure your hands are clean and dry before preparing your dose. Load 1 capsule in the inhaler and breathe out completely, holding the inhaler level and away from your mouth. While keeping the inhaler level, close your lips firmly around the mouthpiece and take a deep, comfortable breath. You should hear and feel the capsule whirl, spin, as you breathe in. Take the inhaler out of your mouth and hold your breath for 5 seconds, then breathe out. Remove the used capsule from the inhaler. Repeat with a second capsule to finish a full dose. Take used capsules out of the inhaler before storing the inhaler. Do not store unused capsules in the inhaler for a future dose. The dosage of Inbrija capsule with inhalation device is based on your medical condition and response to treatment. Do not use more than 1 dose per OFF period, and do not use more than 5 doses in 1 day. If your condition does not improve or if it gets worse, be sure to tell your doctor. Some common side effects of Inbrija capsule with inhalation device may include coughing, dizziness, lightheadedness, nausea, trouble sleeping, unusual dreams, stuffy/runny nose, sore throat, fever, and changes in saliva or nasal discharge color. To reduce the risk of dizziness and lightheadedness, it's important to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks. However, some people using this medication have experienced sudden drowsiness or falling asleep during their daily activities. If you experience increased sleepiness or fall asleep during the day, do not drive or do other possibly dangerous activities until you have discussed this effect with your doctor. It's important to seek medical attention if you experience any serious side effects such as new or worsening movements that you can't control, fainting, vision changes, severe stomach/abdominal pain, mental/mood changes, signs of infection, unusual tiredness, or chest pain. Suddenly stopping or reducing the dose of this medication may rarely cause a very serious condition called neuroleptic malignant syndrome, so it's important to seek medical help right away if you experience symptoms such as fever, unusual muscle stiffness, severe confusion, sweating, fast/irregular heartbeat, or rapid breathing. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, it's important to seek medical help right away. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. Before starting to use Inbrija capsule with inhalation device, it's essential to talk to your doctor or pharmacist about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions. Also, discuss your medical history, especially if you have liver disease, glaucoma, breathing problems, heart disease, kidney disease, stomach/intestinal ulcer, mental/mood disorders, blood disorders, seizures, or sleep disorders. Inbrija capsule with inhalation device may cause dizziness or drowsiness, and using alcohol or marijuana, cannabis, can intensify these effects. It's important to avoid driving or using machinery until you know how this medication affects you. Limiting alcoholic beverages is also recommended, and it's important to talk to your doctor if you are using marijuana, cannabis. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of Inbrija capsule with inhalation device, particularly experiencing cough, stuffy/runny nose, sore throat, or fever. If you are pregnant, Inbrija capsule with inhalation device should only be used when clearly needed, so discuss the risks and benefits with your doctor. Additionally, if you are breastfeeding, consult your doctor before using this medication, as levodopa can pass into breast milk in small amounts and may affect milk production. When taking Inbrija capsule with inhalation device, it's important to be aware of potential drug interactions. Certain medications, such as antipsychotic drugs and those used to treat high blood pressure, may interact with Inbrija. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any serious side effects. Additionally, it's important to avoid taking MAO inhibitors with this medication, as it may cause a serious and possibly fatal drug interaction. Your doctor can provide guidance on when to start or stop using this medication in relation to MAO inhibitors. It's also important to note that this medication may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using Inbrija to ensure accurate testing. In terms of daily dosage and timing, it's best to follow your doctor's instructions. They will provide guidance on the optimal timing for taking Inbrija and the appropriate dosage for your specific condition. If you or someone else has taken too much Inbrija and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe dizziness, irregular heartbeat, and changes in mental or emotional state like agitation. It's important not to share Inbrija capsule with anyone else, as it is specifically prescribed for your condition. Your doctor may also require you to undergo certain medical tests to monitor your heart, kidney, and liver function, as well as your blood count, while you are using this medication. It's crucial to keep all your medical and lab appointments to ensure the proper monitoring of your health while taking Inbrija capsule with inhalation device. The Inbrija capsule, with inhalation device, is used to treat symptoms of OFF episodes in people with Parkinson's disease. It is used as needed to reduce the symptoms of Parkinson's disease such as shaking, stiffness, and difficulty moving. The daily dosage and optimal timing of this medication should be determined by your healthcare provider. It is important to follow their instructions and use the medication as directed. When storing Inbrija capsule and inhalation device, make sure to keep them at room temperature and away from light and moisture. It's important to keep the inhaler and capsules dry, so avoid storing them in the bathroom. Be sure to store all medications in a place that is out of reach of children and pets. When it comes to disposing of Inbrija, do not flush the medications down the toilet or pour them into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. If you're unsure about the best way to dispose of Inbrija, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.